I loved innovating, creating solutions. Engineers, they're people, they just love problems. My name is Panicos Kyriacou. I am a professor in biomedical engineering. I'm also the director of the Biomedical Engineering Research Center at City University of London. And every wearable device that you see on the market, if you flip it, you will see a light underneath. A green light, maybe a red light. That is using the technique of photoplethysmography, PBG as is known, where this lab is internationally renowned. For us, the utilization of light in sensor technologies enable us to interrogate the body. Whether we're interrogating the skin, the blood, that fusion of knowledge of software, hardware, and sensor technologies can create amazing solutions in healthcare. We have been visited by neurosurgeons. They said, do you think we can monitor intracranial pressure in traumatic brain injury patients non-invasively? You get a patient after a big accident, the pressure in the brain is rising. And if it's rising, it will create bleeding in the brain or a hematoma. They put a hole in the scalp, and then they inserted into the brain a sensor. And it is the most invasive, non-therapeutic procedure. Harnessing the knowledge of light that we have, we developed the first non-invasive optical sensor. We place it on the forehead, we shine light into the brain, and we do know from studies we've done in our lab that certain colors or certain wavelengths of light can penetrate into the brain. But some light comes back. It was amazing. The most beautiful signals coming back from the brain, and then we apply machine learning models in order to tell us how that light is affected by hemodynamic changes in the brain. And people said it cannot be done. We won the Britain STEM Award a couple of years ago, which is a very prestigious award. And very recently, the university has licensed this technology to a consortium from the Netherlands, where a company will be built, UK-based company, to take this forward to commercialization. When I was growing up, I felt very passionately about engineering. Also, my other dichotomy, I loved medicine, to become a medic to save people's lives. I met a very inspiring professor of medical physics and bioelectronics. So they took us a little tour around the hospital. He was passing the message, look at this technology here, look at the X-ray machines, look at these surgical instruments, look at these monitors. Do you know who built these technologies? He says they're called biomedical engineers. They're engineers. Medics or clinicians, they're in the business of saving lives. Engineers are in the business of saving lives as well. When we develop technologies and they connect it on a patient, it's a shared responsibility in saving that patient's life. And I thought, God, you're in the right place. That's it, I was sold basically. At the end of the day, we are in the business of creating healthcare solutions for everybody. Developing non-invasive technologies for all those populations, whether it's a medical device for use in clinical practice, whether it's a wearable device for use for well-being, is a direction that only grows. And people say, what's next? Okay, we have a watch, we can monitor our heart rate. What would be the next one? Obviously, it's the wish list of everybody, is to reach the level where we have a technology so powerful and futuristic. You place it contact or non-contact on a patient or a person at home, and it will tell you what's wrong with them. But if you look at the trajectory of where science, engineering, medicine is going, it is in the right path towards that direction. And for me, as a biomedical engineer, I enjoy doing research, but what I enjoy more is to be able to see the translation of these technologies to the bedside, to improve the quality of life. Seeing that and seeing the faces of the people, patients, their carers, and their families, that's what drives me.